Understanding stroke. A simple definition. A stroke is a sudden, serious medical condition akin to a brain attack. It can happen to anyone at any time and often without warning. The impact of a stroke can be devastating, affecting not just the individual but also their family and friends. It occurs when blood supply to part of your brain is cut off, depriving brain cells of oxygen and nutrients. This interruption can be due to a blockage or a burst blood vessel. The brain, being highly sensitive to changes in blood flow, starts to suffer almost immediately. Without blood, brain cells begin to die within minutes, making speed crucial. The faster medical intervention is provided, the better the chances of minimizing brain damage and improving recovery outcomes. There are two main types of stroke: ischemic and hemorrhagic. Understanding the difference between these types is essential for effective treatment. Ischemic strokes, the most common, occur when a blood clot blocks an artery to the brain. This type accounts for about 85% of all strokes and is often linked to conditions like high blood pressure, high cholesterol, and diabetes. Hemorrhagic strokes, though less common, are often more severe, caused by a burst blood vessel bleeding into the brain. This can result from conditions such as aneurysms or uncontrolled high blood pressure. The brain controls everything you do, from movement to memory. It is the command center of your body, responsible for your thoughts, emotions, and actions. Stroke damage can lead to loss of these functions, depending on the affected brain area. This can result in physical disabilities, cognitive impairments, and emotional challenges. A stroke is a medical emergency. Every minute counts. Immediate medical attention can significantly improve the chances of survival and reduce the risk of long-term disability. The longer the brain lacks blood flow, the more damage occurs, potentially permanently. Time lost is brain lost, emphasizing the need for rapid response. Recognizing signs and getting help fast can save lives and reduce disability. Common symptoms include sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking, and severe headache. Never ignore potential stroke signs. Acting quickly can make all the difference in preserving brain function and quality of life. The brain is the command center for your entire body. It controls everything you do, from breathing and heartbeat to thinking and feeling. This intricate organ is divided into several parts, each responsible for different functions. Each part of the brain has specific jobs, like controlling movement, speech, and memory. For instance, the frontal lobe is involved in decision-making and problem-solving, while the occipital lobe processes visual information. When a stroke occurs, blood flow interruptions starves brain cells of oxygen, causing them to die quickly. This can happen due to a blocked artery or a burst blood vessel. The lack of oxygen leads to immediate and often severe damage. The longer the interruption, the more cells are affected, emphasizing the urgency of treatment. Rapid response is crucial to minimize brain damage and improve the chances of recovery. The stroke's impact depends on the affected brain area. For example, a stroke in the left hemisphere can affect speech and language, while one in the right hemisphere might impair spatial abilities and creativity. Damage to the speech area impairs talking. Motor cortex damage affects movement. Rehabilitation often involves speech therapy, physical therapy, and occupational therapy to help regain lost functions. Stroke effects vary widely, from minor issues to severe disabilities. Some people may experience temporary weakness, while others might face long-term challenges like paralysis or difficulty speaking. Physical abilities, mental functions, and emotions can all be impacted. Emotional support and mental health care are essential parts of the recovery process, helping patients cope with changes in their lives. Understanding these impacts aids in recovery preparation. Comprehensive care, including medical treatment, therapy, and support from loved ones, plays a vital role in helping stroke survivors rebuild their lives. Knowing the signs of a stroke is vital. Quick recognition can save lives and reduce disability. The F.A.S.T test helps remember key signs. F for face, ask for a smile, check for drooping. A for arms, raise both arms, look for weakness. S for speech, listen for slurred or unclear speech. T for time, call emergency services immediately if signs are present. Age and other factors. Who is most susceptible to stroke? Understanding who is most at risk can help in prevention and early intervention. Stroke can affect anyone, but some groups are at higher risk. Recognizing these groups can lead to better health outcomes. Age is a significant risk factor. Risk increases with age. As people grow older, their arteries can become narrowed or blocked, leading to higher stroke risk. Atherosclerosis and rising blood pressure contribute to higher stroke rates in older adults. These conditions can be monitored and managed with regular checkups. Most strokes occur in people over 65, but younger individuals are not immune. Lifestyle choices and genetic factors can also play a role in younger populations. Awareness across all ages is essential. Education and community programs can help people understand their risk and take preventive measures. Other risk factors include high blood pressure, smoking, diabetes, and family history. These factors can significantly increase the likelihood of a stroke. Many factors can be managed with lifestyle changes or medication. Regular exercise, a balanced diet, and quitting smoking can all contribute to lowering stroke risk. Confirming a stroke, the diagnostic journey. Quick diagnosis is critical for effective treatment. Treatment depends on stroke type, ischemic, clot, or hemorrhagic, bleed. The diagnostic process starts with a physical and neurological exam. Doctors assess symptoms like facial droop and arm weakness. Brain imaging, like CT or MRI scans, confirms the stroke type. CT scans quickly show brain bleeding. MRIs detect ischemic strokes. Additional tests like blood tests and ECGs help guide treatment. Life after stroke. Navigating potential challenges. Stroke effects vary based on location and severity. Recovery is unique for each survivor, often involving adapting to new limitations. Physical challenges include weakness or paralysis, affecting daily tasks. Communication issues, like aphasia and dysarthria, can arise. Cognitive problems, such as memory difficulties, are common. Emotional changes, including depression and anxiety, may occur. Support from healthcare professionals and loved ones is crucial for recovery. Pathways to healing. Treatment and recovery from stroke. Immediate treatment is vital, differing for ischemic and hemorrhagic strokes. Ischemic strokes require restoring blood flow with clot-busting drugs or thrombectomy. Hemorrhagic strokes focus on stopping bleeding and reducing brain pressure. Recovery begins with rehabilitation, involving specialists like physiotherapists and speech therapists. The journey of healing takes time and determination, with neuroplasticity aiding recovery. Support from family and friends is invaluable, and progress, though slow, is possible. Celebrate small victories and focus on recovery.